Good afternoon, everybody, and welcome to the Partnership for Maternal and Child Health of Northern New Jersey Town Hall on COVID vaccine and pregnancy outreach. This is the first in a series of 3 town halls that we will be doing this month. And welcome to all of you. My name is Virginia Middlemiss, and I am the program manager for the Community Health Worker Program with the Healthy Women, Healthy Families grant, and we are funded by the New Jersey Department of Health. And the Community Health Worker Program oversees community health workers in the 5 northern counties with the partnership and all 21 counties in the state of New Jersey. And with our COVID vaccine and pregnancy outreach, we're really trying to support the community with information to answer questions. And as we know, while the majority of the population is vaccinated, it is possible that people feel unsure and have questions, and our role here today is to really present as much information and resources to anybody who does have questions. So with that, I would like to introduce to you our panelists. We have Dr. Marian MacArthur, who is a board-certified OBGYN and has been practicing for 40 years. She is currently the medical director at the Cooperman Barnabas OBGYN Clinic in Livingston, New Jersey. And the clinic is a resident teaching clinic serving Medicaid and charity care patients with 300 deliveries in a year. So if you want to wave or say hi. Okay, and then we also have Tanisha Malden, who is a licensed practical nurse, a nurse manager, OBGYN department at Metropolitan Family Health Network in Jersey City, or in Hudson County. You have several locations. And Tanisha's role started as the OBGYN staff nurse 10 years ago, and then in 2012, Tanisha was given the opportunity to lead the department as nurse manager, and she finds her work to serve the community in this capacity at Metropolitan extremely gratifying. So if you can wave and say hello. And finally, we have Jill Wadnick, who is a Lamaze childbirth educator at Montclair State University and works on improving maternity care in policy and systems. And through Montclair State, she has a consultant to the new Every Mother Counts childbirth education module, Choices in Childbirth. And Jill works on parity reimbursement for birth centers and midwives with a focus on respectful maternity care. Jill also focuses on ecological sustainability and the role of environmental racism on maternal health. So with that, I'm really excited about our panelists, and we're going to start with some questions, and I will be focusing this first question for all 3 of you. So if we can start with Dr. MacArthur. Over the past 2 years, the COVID pandemic impacted almost every facet of our health and lives. What impact has the COVID-19 disease had on those who are pregnant?
Hi. Basically, it's been 2 years. In the 2-year period, we've had our peaks and valleys. In the very beginning, as everybody remembers, there wasn't a vaccine that anybody could take, so we needed to practice social distancing, masking, and frequent hand washing. For thus people who were in pregnancies, because of the pandemic, we found we had to space visits out, so you couldn't get seen as often for your prenatal care. Some people used telemedicine to fill in the gap between the visits so that you could still get information and self-monitor from home for some of the things that you could do. And then the other impact was we found for people who were not vaccinated, who got sick with COVID, that it seemed, again, healthcare disparity came into play. There were more Black and brown people who got sick with it, and anybody who wasn't vaccinated, if they were pregnant, ran the risk of having a preterm baby or a stillbirth. And we had, a lot of admissions for preterm. Sometimes you were able to stop it, or other times the baby came and went to the NICU. The other thing that happened is if you're pregnant and you get COVID, you have a much greater chance of ending up on a ventilator. And that was not a good thing, because most of the people in the beginning, we weren't able to get off vent. So we had some deaths of mothers where, you would be running to do a delivery, emergency section to get a baby out that could still survive, and then you might lose your mother. So that was the sad story of COVID in the very beginning. Now we have vaccines, and what we found out is people who get vaccinated do better. It's not to say that you can't get it, but if you get it, you will probably not end up in the hospital. You will not be on a ventilator, and you're not risking death. So that was the impact that I've seen over the past 2 years.
Okay, thank you. And Tanisha, can you add to that from your experience at Metropolitan?
I'm going to piggyback off of what Dr. MacArthur said. We basically saw a lot of patients were afraid of not being able to be seen by our providers because we had to lower our number of patients. So that was very, very difficult for them. They were very worried, like, well, I'm not going to see them in 2 weeks. Is that going to be okay? Sometimes we have to extend it, and they were used to us educating them, at a certain amount of weeks, 28 weeks, you're here every 2 weeks. And then, so they were a little afraid of something happening to the baby if they wasn't seen exactly 2 weeks. So that's what we faced here at Metropolitan.
And Jill, do you have anything to add to that?
I'm really leaning in to just listen to with the humility of how all of us reflect the last 2 years. As a Lamaze childbirth educator, we all pivoted online from in person. I was at a community clinic on Route 46 with Montclair State, and so we went online, and surprisingly, I had tremendous enrollment in childbirth education, partly because parents were immediately seeing in March, April of 2020 that maternity care, especially in northern New Jersey, was adapting almost overnight and on the spot. And so there was more interest and more urgency for families to have realistic expectations. So am I going to be tested for COVID, or what happens if my baby tests positive for COVID? And so really hearing the anxiety, really hearing the concerns, and at the time the partnership was doing really important updates from the member hospitals in northern New Jersey. And so I was using, as a childbirth educator, we were really wanting to keep communication and help families ask the questions, but it also was important to convene consistent information. So for example, with how quick discharges were. And there's a tool that the March of Dimes created for families who are pregnant, with specifically that I still use 2 years later, 2.5 years later, about COVID-19 pregnancy, labor, and birth, because I feel it's a communication tool, and I know this will be shared later, that gives expectant families questions to ask their healthcare provider in those prenatal appointments, as well as the facility for labor and birth. And I just want to reflect really, part of why I chose to do this panel is really, again, with the deep humility and the research, that there have been so many more pregnant people that have gotten sick, preterm babies, low birth weight, and the research is really showing preeclampsia. And so it is with the depth of recognition of the global crisis of COVID-19 and the mobilization that how can, since I only do education and I don't do assessment, nor evaluation, nor treatment, how can childbirth educators be allies to make sure that families get supportive information and resources?
Thank you very much, Jill, for that answer. So I'm going to do either Dr. MacArthur or Tanisha, do you have anything to add, or I'm going to move on to the next question. Okay, so the COVID vaccine is recommended for everyone now over the age of 5. How does the vaccine work, and how effective is this? And I'm going to focus this question to our 2 medical professionals in the room. Dr. MacArthur?
Okay, yes, they recommend the COVID vaccine. For now, we have up to 5 and up, but pretty much there's three vaccines that we use primarily in this country: Pfizer, Moderna, and Johnson & Johnson. The Pfizer and the Moderna are the ones that have gotten a lot more attention because they're messenger RNA vaccines. Just to let you know what type it is. Pretty much when they make vaccines for everything from flu to Tdap, there are many ways that they make it. The messenger RNA vaccines are unique in the sense, I like to think, I don't know who the audience is, how old people are who are listening. If you're old like me, think Mission Impossible, when they would get the little message in the beginning that tells you to accept this mission, and then the message self-destructs. If you're younger, I'm going to say an Insta story. It's there for 24 hours and it's gone, okay? So that's the way you need to think about messenger RNA vaccines. What's happening is the vaccine is sending a messenger in. The messenger is going to go into the cell. And if we think back to science class, we know the cell has the nucleus, which is like the brain. It doesn't go into the nucleus to do what it has to do. It gives the message to some other little components of the cell. So it's only going to be there for a day and go away. So it will never do anything to change you, where people in the beginning worried. And I was one of those people that, what's going to happen to me down the line if I take this vaccine? You know, what kind of things will happen? And once I got more information and learned it was just a message which was going to self-destruct, then I knew I didn't have to worry about, was I going to grow an extra eye a couple years down the road? And that's the way I like to explain it to people. So you're either the Mission Impossible person or you're the Insta story, but it's just temporary to give instructions. And once it gives the instructions, then your body's able to make the antibodies to respond and protect you and your baby from COVID. Other vaccines that you get, like flu and Tdap and stuff, sometimes they'll use an inactive piece of the particle to prepare the vaccine so that your body can recognize something foreign and know if you see that attack and protect the person. But really, for what we need to be thinking about in terms of pregnancy, mostly we're recommending take a messenger RNA. Don't take the Johnson & Johnson unless your situation is that's the only thing you can get. Then that's better than taking nothing. And as far as effectiveness, they're high 90% for Moderna and Pfizer, and Johnson & Johnson was about 70% protection. So.
Great, thank you. I like that analogy of Mission Impossible because that's my generation. But the Insta story is great too. Tanisha, do you have anything to add on that?
I love her story. She said it all. She summed it all in one. Very good, doctor.
Okay, so with that, I'm going to move on to our next question. And Tanisha, I'm going to start with you on this one. Several vaccines are recommended by the CDC and health experts, including the flu and whooping cough vaccines during pregnancy. How does taking a vaccine during pregnancy work to protect the health of the baby?
So taking the vaccine during your pregnancy, it helps to prevent severe illness and death also. We highly recommend the COVID. We do Tdap at 28 weeks. We recommend the COVID vaccine because it helps pass as antibodies onto the babies, so that once the baby is delivered and living, that baby has immunity for up to 6 months. So we try to encourage that to the patients. A lot of mothers, they get nervous, you know, oh, the vaccine, and they hear stories, oh, I'm going to turn green or something like that. And we try to calm them down and educate them on, no, that's not going to happen. This is here to help you as well as your baby. So when you put it like that, say, you know, you're a mom, right? Your instincts kick in, not when the baby is born, but inside the womb. Your mother instincts should kick in too, right? To fight for that baby. So if you're given the vaccine, you're fighting for that baby also. So that's how we try to educate them. You're starting the fight with the baby in the womb. So that's why we educate them, and we try to strongly promote the COVID vaccine. Once they hear that severe illness, they're like, okay, we'll take it. So we try to promote it strongly.
Okay, thank you. And Dr. MacArthur?
I would say Tanisha summed it up nicely, that Tdap is definitely something you need to take. Flu, again, because you can get pretty sick with that. The only thing I would add is that people sometimes worry about how soon can I have something if I just had a vaccine. They can be given at the same time, even it's not going to interfere one with the other. And it's basically protecting your baby, making sure that there's nothing around when you take like the Tdap, then your baby won't end up with whooping cough. And again, family members and stuff who haven't had it take the vaccine too, so that when the grandparents come around, you're not then presenting the baby with something that it shouldn't have. So be a good mother, take your vaccines.
And I'm glad you brought up family members, and we will kind of touch on that a little bit later as well, because that's a really important part of our expectant mom's population. Her world is her family members too. So that's very important. So this question is going to be to all of you. Despite the vaccines, including the COVID vaccine being recommended during pregnancy, and to those who wish to become pregnant, there are still some pregnant people who are unvaccinated. What would you say to those people who are feeling unsure about getting the vaccination? And Jill, I'll start with you.
Yeah, I really, approach this conversation with really gentleness and respect about the vulnerability. And so I would just encourage, I think sometimes it's so charged that it's important that we all move away from being reactionary or defensive in terms of sometimes how media headlines present everything. I was reading research from Maven, which is a health organization, that only about 26% of pregnant people are vaccinated for COVID-19 right now. And so if we don't approach this with gentleness and respect, to really talk about, and I'm going to actually, I'm actually going to read something that was summarized from Lamaze International from looking at the research. I'm going to read it. It's only one sentence, just so I don't get the words wrong. It says, the benefits of the COVID-19 vaccine seem to outweigh the risks of getting COVID-19 while pregnant, the latter of which has been shown to put pregnant people at higher risk of increased morbidity and mortality. And so talking about the vaccine and the unintended consequences of getting COVID-19 are catastrophic elements that are hard to think about, right? And so I don't have an easy answer. I want every person to really use this opportunity to understand, as health educators or healthcare providers, we're in a system that historically has not done a good job at trust, at intentional time, and that's part of how maternity care is delivered. You might only get 5 to 6 minutes just based on, and so the issue of trust and the issue of just consistent care and collaboration and using evidence-based resources and tools, I think hopefully will give every family an opportunity to understand information and understand. I really like the language of benefits versus the risks of getting sick with COVID when pregnant.
Thank you, Jill. And Tanisha or Dr. MacArthur, would you like to weigh in?
What I basically tell my patients when they feel a little unsure, sometimes you give them the material to read, and I always say, read and do your research. We can educate you and tell you what the CDC says and how we may interpret everything and we may feel about it, but do your research. And when you do your research, make sure it's from a reliable source. Okay, CDC. We go to those websites. So it's like, sometimes when they read it, when you tell them something, they'll take the piece of paper and go home, be like, oh, okay, I'll read it. And then you call, follow up, like, did you do some research? Did you look? And it's like, oh, you know what, Miss Tanisha, yes, we did. And you know what, I'm going to come back. And I'm like, yes, thank you. So I do recommend, I'm going to give you the information. I want you to take it home and read it, but I'm going to follow up with you also to make sure that you understand and that you did. And sometimes you ask them questions to make sure they did read it. So yeah, I would say definitely do your own research. And if you have any questions, come back to us and we'll be more than happy to help calm them down and to relax them.
Thank you, Tanisha. Dr. MacArthur?
I would just add, I guess for me personally, I like to interact with patients and make it a personal experience. I think that the more patients get to know you and trust you, most times people want to get information from somebody they trust. I like to use race as a factor since I'm a Black woman. If I'm dealing with my Black and brown patients, I'm going to say, hey, it's me, one of you, talking to you. While you have me sitting in front of you, what questions do you have? And try to get a sense of what is their understanding or why they don't want to take the vaccine. What about it is making you say no? And then they have a chance to express whatever it is. And sometimes it's misinformation, which you then can correct. People will ask you interesting questions, or they'll just say, I'm not so sure. I think I'll wait till after I have the baby. Then that's when we reinforce what could go wrong. And I like to reinforce that right now there's no vaccine for little babies. And so that if you do take the vaccine, your baby's chill until 6 months, and maybe by then there will be something for the younger kids. So I push that. And then again, just asking them if they know anybody who's had COVID. And a lot of people do know someone. Do they know anybody who had a bad outcome? And then sometimes if I do that, they'll ask me, well, you work in the hospital, what have you seen? And then I have my stories that are horrible stories that I can say this happened to this pregnant person, and without being HIPAA compliant when I'm giving the information, but basically explain to the patient, this is what happens. Because I think you can see things in the news and hear things, but you don't really think that something bad is really going to happen, or that the person survived, but now they're not the person they were before because of long COVID. They had seizures, they were intubated, they're still on a trach. It's 3 months later, they spent 3 months in the hospital. So that kind of stuff, they need to hear that you really saw it, you were in the hospital, it's not something from the internet. So that helps some people. And then there's going to always be the person who says, nope, I'm not doing it. And at that point, I have to remind myself that patients have the right to choose what they want to choose, even if it's the wrong choice, and acknowledge, okay, this is what you're choosing. It's not what I think is best for you, but you get to make the choice. And usually that kind of ends the conversation. We can bring it up again at another visit to see if they've evolved, if things have happened that would change their view in terms of how they're looking at it. But that's what it is. So.
Okay, thank you. And this next question, and I know I'm actually going back, Jill is going to share some of the tools that she's referencing. So we will have those because this is being recorded. So we will have access to, or you will, as audience members or people who join on at a later to watch the recording, will have access to a lot of the information that's being referenced here. So this is directed to both Dr. MacArthur and Tanisha. How do we know that the COVID vaccine is safe for both mother and baby? It's a pretty straightforward question. Dr. MacArthur, do you want?
Yeah, I'm going to say when you sign up for your vaccine, you have a chance to sign up for VSafe, which is a vaccine monitoring system. That's nice that they get your cell number in the beginning. The first 24 hours, you're going to get a little text asking you how to fill out a survey. How are you feeling? What are you doing? And then they ask also if you're pregnant, so that if things happen, they're keeping a track of what's happening with the pregnant people. And a lot of people have told me in the beginning when the vaccines became available, well, they didn't test it on pregnant people, so I don't know that I should take it because maybe it's not safe. There were probably some people in the trials who didn't know they were pregnant yet at the time that they were in the trial. So there were a few, not a lot. But since they've started doing the COVID vaccines, they have thousands and thousands of people who were pregnant getting the vaccine, that they followed all of those people. Nobody's had anything terrible happen to them. People will say, I had a reaction. Yes, you might get a little fever. You might get the sore arm. Those are normal things. That's not a bad reaction. And if you're pregnant, take Tylenol so that you don't have your fever for a prolonged period of time. But basically, it's, December of 2020 was when the vaccine came out. So it's been around for a little bit, and enough pregnant people have had it that I think that we can safely say it's fine. And it certainly didn't do anything bad to babies. And even in the moms who got COVID, there didn't seem to be transmission to the baby. So it's a good thing.
And Tanisha, and do you want to add anything to that?
No, Doctor said it all.
So the next question, then I'll direct to you, Tanisha, is emerging research does confirm that the COVID vaccine is safe and effective for those who are pregnant or wish to become pregnant. So are there any circumstances where you might recommend the client or the patient to not be vaccinated?
I recommend the vaccination to everybody, only if say they received the first dose and they had a severe allergic reaction, then maybe I would say you may not be a candidate for, the vaccine because of the severe allergic reaction you had after the first dose. But that's the only time I would say no to giving a COVID vaccine. I recommend it to everybody.
And Dr. MacArthur?
I would say ditto. Most people don't, thank God, have the anaphylactic reaction, and most places that are giving the shots are set up to deal with that if you do have that reaction. But the only other group that I would think of is anybody who's ever had any injectable type of thing that had an anaphylactic reaction. That's the person you want to be very careful with. It might not have been the COVID vaccine, but that's the one who needs to be where everything is in place to take care of them should something happen.
Okay, thank you. And then also to both Dr. MacArthur and Tanisha, if someone is already vaccinated and becomes pregnant, should they get the booster shot or wait until after giving birth? And whoever wants to weigh in on that.
I'm going to say it's a no-brainer. Pretty much
we
the
recommend it.
recommendation is if you get a shot, a certain period of time you're due for a next shot. It doesn't matter if you're pregnant or not, take the next shot. When you're due for your booster, take your booster. So everything should happen. You don't have to delay or wait. Just keep going.
That's what we recommend too.
Okay, great. Thank you. So then, are there any benefits or risks that moms should know about the COVID vaccine if they're breastfeeding or considering breastfeeding? And this I'm going to open up to everybody here on the floor. If Dr. MacArthur, you want to start?
Breast is best, especially in our formula shortage time. Everybody think breastfeed. But basically, antibodies can be passed through breast milk. They've been able to show that. So again, it's another way to give your baby the benefit of the antibodies that you've gotten to protect it. And since there isn't a shot for those little babies, so that's why I'd say breastfeeding is not a problem. And as far as getting vaccinated, or if you've been vaccinated, it'll help.
Yeah, I'll jump in and say, in addition to being a Lamaze childbirth educator, I'm a member of the New Jersey Breastfeeding Coalition and involved with policy and advocacy through the United States Breastfeeding Coalition. And so I would direct everyone to those two websites, one that has regional state information and one that has national information. And thanks to really champions through the International Lactation Association, the USBC, NJBC, and we really have tools and supports for women and people who are lactating, really about the urgency of getting support, because breastfeeding is not always easy, especially in the beginning, and that continuity of care to make sure that infants get breast milk is one of the best protective factors we have right now, both in the pandemic and in the formula shortage. But we don't want to put the burden on the individual. We really want there to be collective care and community resources, policies, and systems that are really set up. And so just to amplify, all of those organizations have resources and tools about the safety and efficacy and urgency of breastfeeding right now.
Tanisha, do you have anything to add?
I would say it's all beneficial.
Thank you. So now, what would you say, and this again is to all three panelists, what would you say to your patients to help them know that getting vaccinated for COVID during pregnancy is a good choice for them to make? So I know we've kind of touched on this in some of our other questions, but now you're having the conversation, and maybe we're including some of the family members and expanding on the conversation, or you have a partner in the room. What would you say? And this is open to everybody.
I guess basically, you want to go, doctor? So I would tell the patients and their family members that basically, you educate them, you reassure them on the vaccine. You try to encourage that everybody in the household becomes vaccinated. You try to also emphasize on when you're bringing the baby home about having everyone vaccinated, because that can help also. We just basically try to encourage and give all the benefits of being vaccinated. And that's basically it.
I have a different role and scope since I'm not a clinician, and my role is really only health education for the perinatal period. But this is where I will, in terms of other topics that most expectant families want information on, stages of labor, comfort measures, delayed cord clamping, things like that. So Every Mother Counts and other organizations really have information on COVID-19 and pregnancy embedded within all of those other perinatal health resources. And I think that's a way of really being respectful and listening with families, because a lot of times it is partners or dads or spouses or doulas that want some of those, all of the information about preparing for labor and birth. And so it can be bundled with all of that anticipatory guidance on things that are really meaningful and relevant in the daily lives of those who are pregnant.
Thank you. And Dr. MacArthur?
I was just going to say, I think of stressing that pregnancy is one of those times where you're very giving because you're nurturing and you're getting ready to bring someone new into the world, and you're being very selfless to do all of this for the 9 months it takes to get someone here. And I like to think of it as getting vaccinated as being selfless too, because you think about who your family is, who is your community around you. God forbid that you went someplace, got sick and brought something home, and then there's somebody elderly in the family who gets sick and dies. So I like to stress, do it for everybody who's your little village. And if you think of it that way, then all of you can get vaccinated to help each other. It's not just doing it for yourself, you're doing it for everybody that you live with.
Great, wonderful, wonderful answers. I really appreciate that. So I'm going to open it up to any last minute thoughts, comments, and then we'll see if there are any questions coming in from any of our listeners. But Dr. MacArthur, do you have a final wrap up or anything that we didn't touch on that you would like to add that maybe feels pertinent to what we've discussed?
I guess the only last minute thing that we didn't talk about is so much as, people who are anti-vaxxers who are never going to change, and how people feel about their individual freedoms. And again, it's bigger than yourselves. If you're not going to take the vaccine, at least do the things that you should be as far as social distancing, frequent hand washing, and masking, even though there are those people who feel that masks interfere with their personal freedoms. And I think that at some point you have to think of this whole pandemic as a public health issue. It's not about you individually and what you like to do. So I would say if you have friends who are not doing what they should, encourage the behavior with your friends. And hopefully more people, I'm just like a little bit disappointed that more people in this country haven't taken advantage of all the vaccines we have. So many people in other parts of the world wish they had access to what we do. So let's be mindful that there are plenty of others who would like to have what we have and take advantage of it, not be stupid about it. And also to recognize that COVID's going to be with us probably forever, just because it is a global pandemic. And until we can do stuff to help the rest of the world, we're never kind of going to get rid of it. So adjust your perspective as to what you have to do to have a quote normal life, and let's all do what we can to make it better for everybody.
I would really, as a childbirth educator, there's a lot of emphasis, and again, also as a doula, about making sure that families get access to high value evidence-based maternity care. And so that's one of the reasons I keep falling back into this tool from evidence-based birth, because evidence-based birth really has a Q&A for expectant parents and families on COVID-19 vaccine and pregnancy. And so the same way we would want to make sure that there's evidence-based maternity care, and we know that that's an unbiased commercial-free resource, that's, I'm going to keep amplifying it. And so I would just make my last remark, again, if I can just read a couple of sentences, because I think it gives added value to doulas and consumers who may just really understandably feel some vulnerability. And so this is from Evidence-Based Birth. It says, pregnant people with COVID-19 infection are at higher risk for more severe disease, especially for those who are unvaccinated. When compared with non-pregnant people, pregnant people with COVID-19 were increased risk of intensive care admission, respiratory support, and pneumonia. And so again, from a harm reduction perspective, we have evidence that this really helps the well-being and reduction of severity of disease. And so as someone who wants evidence-based maternity care, I'm really glad to share some of these tools with families.
Okay, we look forward to, again, sharing those tools with as many of our community members as possible. And Tanisha, what are your thoughts and comments here before we see if there are any questions?
I would say what sums it all up is just to the moms to do what you feel is best for you and your unborn baby. Don't listen to outside people, because you know sometimes people can get in your ear and they say, well, don't do this, don't do that. Do what you feel is best for you and your baby. And protecting them, that's the first thing that moms always want to do, is protect their child. So giving the vaccine, you're protecting you and the baby. That's what I have to say to sum it all up. Protect you and your baby.
I'm mumbling and I'm muted here. I know the way it is. We're getting a lot of great information. Thank you, Jill. Oops, I do have one here. How can we speak to people who have had bad experiences getting a vaccine and do not want to hear anything about the vaccine? That's a great question, because as we, some people have had, reactions with their second shot or different things, and maybe it's the booster or even the first one or other people they know. So how would you answer that question? Whoever wants to go first.
Okay, I'm going to use my experience. Okay, so my first dose, I didn't have any reactions. My second dose, I had a very bad reaction. So from my experience in giving advice to them, I would say make sure you have your Tylenol. Sometimes, oh my gosh, my experience was so bad. But I would just say encourage them even more, because sometimes our bodies do go through certain reactions whenever we do get something foreign injected into our bodies. So I would promote it even more, like try to calm them down and relax them, and try to say, you know what, this was just your first experience. The second one may not be like that. I would try to encourage them on that note, to try to persuade them to take the vaccine, the booster.
I guess I would say it's hard to say when somebody has a general question like a bad experience. One person's bad experience is somebody's, it was nothing. Just talking about personal experience, I guess I had the first week it came out, I got the shot, and I thought, oh, this is cool, nothing much. And then later my arm was very stiff, and it got to the point where it felt like it was a cement block when I went to bed that night, and I had to literally lift it to put it down in the bed beside me. And that was that, but that lasted just for the 24 hours, then it was gone. I had my arm back. When I got my second shot, and I said, okay, maybe I'm gonna feel worse because it's a second shot. All I had was a lot of fatigue, and it happened to be at a time when I had a lull between working dates. I was home on the couch watching TV or having the TV watch me for 5 days, and then I was back to my usual self. I had the booster, nothing happened. So I think that there are lots of things that are normal that people might say, this is a bad reaction. If you swell up, if other things happen, that's a bad reaction. And I think a lot of people don't want any discomfort. So if you have any little thing, that's a bad reaction to somebody. So I think it's all relative what's your bad reaction. If it's somebody who had something severe, like almost an anaphylactic, yeah, maybe that person shouldn't be getting either shot. But I think most of us will have little things that show that your body's mounting an immune response, and kind of it's the price we pay to protect ourselves.
Yes,
And I would just add that there might be, you know, again, because pregnant and lactating people have historically been excluded from most trials, understandably, but because of this global health crisis, there has been a really strong mobilization and some advocacy to make sure that elements are documented and making sure that pregnancy and lactation are kind of codified. So there's definitely some research happening with NIRH and some other entities. And there's a lot of professional societies that do have a consumer tool. So Society of Maternal Fetal Medicine, ACOG, ACNM, some of the midwifery organizations are able to link consumers to any of those elements about reactions and responses, as well as, again, information and data.
I just wanted to add, in terms of bad reactions, I thought about it when you talked about what people might have. A lot of ladies got lymph node swelling under the arms and stuff like that. I would just throw out there, just so everybody knows, if you get your vaccine and you get swelling under your arms or in the area of the breast, that can be normal. If you're supposed to have a mammogram or anything like that, wait till 3 months after you've had your vaccine so they don't have something confusing where now you think, oh, I got cancer from the vaccine.
Thank you. We actually have 2 more questions. So this one is, I work with fathers in the community that are sometimes worried about the vaccines because of prior health issues of their partners. What can we tell them in this case? Leave that to our 2 clinicians in the room, Dr. MacArthur or
Yeah.
Tanisha.
I'm going to say, when you said, I'm making sure I understood the question, you're saying the fathers are worried about the mothers because the mothers have some health things. For that father, I would explain to him, just like the general population, the people who have diabetes, hypertension, who are obese, and remember a BMI of 30, which isn't very fat for most of us, is obese. Those people are not going to do as well. Those people have greater risk for bad things to happen if they get COVID. So for that father, I'd say, run her right away to the clinic to get her vaccine because she's in the high-risk group. That's not a reason not to take the vaccine. That's more of a reason to take the vaccine.
Thank you. And then we have another question that revolves around family members, which I think is what a lot of the work that I know the community health workers do, and I'm sure you as clinicians also experience the family members kind of milling around either inside your pregnant person's head or in the space with you. But any recommendations on how to respectfully incorporate the mother or the grandmother into the conversation if the pregnant person's closest supporter is not supportive of vaccines? So it does kind of testament in that mother voice that is often very powerful. I know in the breastfeeding world, we've had the grandmother's opinion sometimes can influence that decision. So do you have any advice for supporting that grandmother or that mother of the
I don't know if I would say it's advice. I think it's just really centering that relational impact, you know, that as a childbirth educator, I may only be in someone's life on their Zoom screen like 4 times, you know, in their pregnancy, or 6 times, you know, before COVID. And, you know, and that grandmother is going to be in the life of that mother baby dyad forever. So I really, I move out of the way, you know, and, you know, try and center that. And again, hopefully that if I am building sincerity and trust, and I'm able to share evidence-based health education, my agenda is to reduce harm and increase efficacy, equity, and love and joy and without an attachment, really. Like I will minimize myself because I think that their grandmother-mother relationship matters so much, and I won't be the only person to give out tools and handouts and resources. So this is where it is a collective care response, and a pediatrician or another clinician, a nurse practitioner, others will have a way and probably get it better than I do, just to hear and just not dismiss or belittle concerns, but hopefully just model a different resource than maybe what's out on social media.
Thank you. And either Tanisha or Dr. MacArthur, do you want to weigh in on this final question before we wrap up?
I would just say that my way of dealing with new mothers is when you have your new baby, everybody's going to tell you what to do and how to do it. And every new mother has gone through that experience where they were made to feel like they weren't doing anything right. And if the mother or grandmother was in the room, I would try to see what was their experience like, or say, remember when you wanted to do this and everybody told you were doing it wrong? I wouldn't say that this is the way you have to do it, but just remind them that this is their baby. Everybody gets to make their choice as to what feels right for them, so that you're supporting both of them, but at the same time saying, remember how it felt to have her tell you you're doing something wrong, so that they might step back a little bit to say, okay, it's her baby, and still maintain their good relationship.
Okay. And Tanisha, any final words on this?
I would say, every female knows that and loves their mother, and they're going to trust what their mother says, So from my perspective, I would say take both advice, right? You have your mom's advice and you have our educational advice, and then do your own research, because again, like we all say, this is your baby and this is your body. So do what's best for you. Mom is always going to give good, advice, but this is your baby and you have to do what's right for them. So that's what I would say. It's tough when, you're dealing with the grandmother. It's a tough situation.
Okay. Any final thoughts or words before we end this great session? Thank you, everybody, for being here and participating. Dr. MacArthur, if you have one sentence to say to everybody at the end, how would you like to wrap up?
My same thing. Please get your vaccine. Do it for your baby, do it for your family, do it for the village that's going to nurture your child. But everybody, do the right thing so we can get past COVID, please.
Okay, Tanisha?
I would say Team Covet Vaccine. That's what I would say.
Okay.
Join us.
And
Thanks for having this conversation. I hope it's not a one and done. It really matters that we can go into the complexity and the need of leaning into trust and sincerity and evidence-based information. So glad to be here.
great. And it is not a one and done. We will be doing 2 additional, an English and a Spanish community-based town hall later in the month. And there will be the voice of community health workers, doulas participating, and we have some other surprise panelists for that session. So be on the lookout for that information. We'll send that to you. And thank you, everybody, again for participating. We really, really appreciate it. And with that, sending you off for a wonderful day. Thank you.